सर हे जॉईन झाले का? हो, तुम्ही पण करा. त्यांचा कॅमेरा चालू करू सर? हो हो. सर तुम्ही मध्ये बघा. सर धन्वंतरी स्टॉनला इकडे यायला सांगू ना. नाही इकडेच सर. जॉईन करायचं. हो हो करायचं. सर ते बॅकग्राऊंड तो टाकायचं ना. नाही ते टेक्स्ट adjust ऑडिओ फक्त ऑन कर. सेट झालं. चालू आहे.
बॅकग्राऊंड ह्याच्यात टाकलंय.
नाही त्याच्यात बॅकग्राऊंड सर टेलिग्रामला आहे का?
ये है कहाँ है, पूरा बता दीजिए। ये भी है, तेरा फोन ले जा।
हम बताएं तो जरूरी तुमचं आहे ना ब्लू स्क्रीन आहे छोटी ते दोन्ही हे करू त्यांचा हे स्क्रीन बंद आहे का व्हिडिओ बंद आहे व्हिडिओ ऑन कर माईकला सगळं लोक दिसतात टू मिनिट्स
Good afternoon, everyone. A gracious welcome to you all on behalf of Mumbai Vaidya Sabha and Ayurveda Prasarak Mandir. Today we have gathered here online for late Vaidya Raj Shrimant Nanasaheb Puranik Memorial Lecture 2025. As you know, due to unfavorable weather conditions in Mumbai, this memorial lecture we are conducting online. First and foremost, I bow in reverence to the noble memory of late Vaidya Raj Srimanta Nanasaheb Puranik, in whose honor this academic gathering has been held. Their vision and contribution continue to inspire us. We are honored by the presence of Professor Banwari Lal Gaur sir as a president and Dr. Kishore Kumar Ramakrishna sir as a guest speaker for today. We also have Honorable Secretary Mumbai Vaidya Sabha Vaidya Shyama Sharma sir, Honorable President Ayurveda Prasarak Mandal Shri Ranjit Puranik sir, Respected Dean Ayurved Mahavidyalaya Sayan Dr. Ravidas More sir. Welcome to all. We will start today's event by Dhanvantari Stavan. I invite Dr. Rutika for Dhanvantari Stavan.
नमामि धन्वन्तरिदेवं सुरासुरैर्वन्दितपादपद्मं लोके भयमृत्युनाशं धातारमीशं विविधोषधीनाम् शङ्खं चक्रं च लौका ददतमृतघटं चारुदुर्भिश्चतुर्भिः सूक्ष्मस्वच्छादिरिन्द्या शुकपरिविलसन् मौलिमम्बोजनेत्रं कालाम्बोधोज्ज्वलाङ्गम् कटितटविलसच्चारुपीताम्बरामि वन्दे धन्वन्तरितं निखिलगतवनं प्रौढदावाग्निलीनं निखिलगतवनं प्रौढदावाग्निलीनं
Thank you, Rutika. I request Vaidya Shyama Sharma sir to guide us about the work of Mumbai Vaidya Sabha and few words about late Vaidya Shrimanta Nanasaheb Puranik. Shyama Sharma sir. Okay. We will start with the introduction of today's president, Professor Banwari Lal Gaur sir. Professor Banwari Lal Gaur stands as a towering figure in Sanskrit and Ayurveda. He commenced his government service on July 30th, 1960. Today's president retired as a vice chancellor of Rajasthan Ayurved University, Jodhpur on March 16, 2011. An academic luminary, Professor Gaur earned his Bishagacharya in 1966, followed by an MD in Chikitsa with his first rank in 1974. He subsequently completed an MA in Sanskrit and diploma in German in first division and awarded a PhD in Ayurveda Basic Principles in 1986. He was conferred with D.Litt honoris causa by Dr. S.R. Rajasthan Ayurved University, Jodhpur in 2024. During his approximately 40-year career, Professor Gaur advanced through roles such as Professor, Director in Charge and Director at the National Institute of Ayurveda, NIA, Jaipur, before leading Rajasthan Ayurved University as a Vice Chancellor. A prolific mentor and researcher, he has authored over 31 books. He supervised a total 72 scholars, authored over 730 research papers, and participated in over 150 seminars. Sir has contributed as a translation editor and project lead for the Charak Samhita translation under Ayush, and as a member of editorial boards for Ayurveda encyclopedia projects. Professor Gaur has been honored with more than 30 prestigious awards, including the Presidential Certificate of Honor in Sanskrit, Charak Shiromani Ayurveda Bhushan, and multiple Lifetime Achievement Awards till 2025. He has been a member of various prestigious committees across the country in a plethora of roles. Ayurved Triguna Award, Ramanarayan Sharma Award, along with Ayurved Siddhant Shiromani Upadhi by Government of Bihar, Ayurved Brahma Upadhi by SDM Hassan, and Ayurveda Bhushan esteemed titles are a few of other achievements. Presently, he heads the Ayurvedic department at Vishwaguru Deepa Ashram Research Center, continuing his scholarly pursuits and contributions to Sanskrit and Ayurvedic knowledge dissemination. Professor Gaur is also the chief editor of Akhila Bharatiya Ayurved Mahasammelan Patrika, New Delhi. His contributions have been recognized nationally and internationally, including official visits to UK, Sri Lanka, South Africa, enhancing the global reach of Ayurveda. Welcome you, sir. Thank you so much for giving us your valuable time. Now we will start with the lecture session. Before that, I will introduce our today's guest speaker, Dr. Kishore Kumar Ramakrishna, sir. Dr. Kishore Kumar Ramakrishna is a distinguished Ayurvedic physician, educator, and interdisciplinary researcher with over 25 years of experience in clinical practice, education, and research. He holds a BMS from GMC Bengaluru, MD in Kaya Chikitsa from STM College Udupi, and was the first Ayurveda postgraduate to receive a PhD from NIMHANS Bengaluru, 2008. His pioneering doctoral research focused on evaluating Hriday Dushti in Vishada, major depression, using heart rate variability, integrating Ayurvedic principles with neurophysiological methods under Department of Neurophysiology and Department of Psychiatry. This work was recognized with CCRAS Young Scientist Award for Clinical Research in 2018. Dr. Ramakrishna has been a scientist at CARI CCRS for 10 years and has contributed significantly across diverse fields including Ayurveda, integrative medicine in mental health, schizophrenia, depression, anxiety disorder, ADHD, neurology, neurodegenerative disorders, neurorehabilitation, neurosciences, metabolic disorders, and geriatrics. He has led clinical research on Ayurveda interventions for depression, obesity, osteoporosis, and aging, and contributed to the development of standardized tools such as the Vishada and Vata rating scales and Prakriti assessment questionnaires. His public health contributions include documentation of tribal health demography and traditional medicine practices. He has published over 50 national and international papers, including a co-authored Lancet Psychiatry Review on traditional and complementary systems of medicine and mental health care. Since 2019, he has played a key role in establishing the Department of Integrative Medicine at NIMHANS, including infrastructure development, academic program design, and research proposal development. Dr. Ramakrishna is currently a member of the syllabus drafting subjects committee under NCISM amongst other noble works. Please welcome, sir, and start with your session and on topic Ayurveda in mental health and neurosciences and integrative health perspective. Welcome, sir.
Am I audible? Hello. I hope I am audible.
Yes, sir. Yes.
Dr.
Your PPTs
Prajakta.
are visible too.
And yeah, my slides are visible.
Yes, sir. Yes.
Okay. Thank you so much.
Thank you,
I
sir.
was a little worried about screen sharing. uh,
Please, sir, please on the slide mode.
yeah,
Please
yeah,
switch
yeah.
on the slide mode.
I understand. I understand. Okay, okay, okay. Fine, fine. So currently, is it full screen?
Yes, sir. Yes. Yes.
Okay, thank you, thank you. Okay, pronouns to everyone. Um, in the beginning, I would like to apologize. I had a very bad throat 4 or 5 days back. Uh, I have just recovered. That's the first thing. And second thing is, it was very unfortunate that I was looking forward to visiting Mumbai and sharing my experiences with the August Ayurveda community in Mumbai, which I missed very badly. So I apologize for that too also. I know it is nature's fury. The third one is I would like to express my heartfelt gratefulness to Dr. Ranjit Puranik. Uh, we met. We have met quite often during the past 10 to 15 years, but then a significant meeting happened in Pune, and then uh, and then now it's become more emphatic with the association with such a big house of Ayurveda. Number three, and before I begin, I would like to offer my Sashtang pranams to BL Gaur sir. I have been Ekalavya to Gaur sir because his Prakhand Panditya is something which of his generations, like I have seen the list of speakers who have adorned the uh, Vaidya Puranik Memorial, lecture series, and among the galaxy of great people who have adorned this memorial lectures, I was extremely impressed, including C.P. Shukla ji and Chunekar Shastri sir, and so many. We have not C.P. Shukla, of course. I was fortunate enough to have to take his blessings, and most of the other like Chunekar Shastri sir, R.H. Singh sir was also, I have had a great, fortunate, opportunity to have met him and learn from him. He was actually my PG examiner, and somehow I have been listening to wherever Gaur sir's class is there. I used to go and attend, and he impresses everyone. And probably he is among the very few of those people in that big galaxy of luminaries who continues to inspire people, especially Ayurveda people, the classical knowledge, a walking encyclopedia, I could say. I think he's among the very few, treasures that we actually uh, adore him. So I'm offering my pranams to you, sir. Also, all the uh, participants of today's uh, memorial lecture is I would offer my gratefulness as well as thanks for attending this particular event. Now the house of Dhut Papeshwar, is quite familiar to me since my childhood. I still remember there used to be a distributorship um, in Bangalore near Cottonpet. So, the name would actually sort of attract people because it was not a normal kind of name. So I would ask my father, what is this Dhut Papeshwar? And he would say that it's an Ayurveda shop and so on and so forth. So I used to walk around those places, and I think I might have been in second or third standard or something. And then after that, it has been, in many circumstances, we have had this opportunity with this house. And then, especially after Dr. Ranjit Puranik took over the mantle, I've been seeing him since then around all over India, and I have not seen him outside India, but at least in India, I've seen him, in many platforms, very active and also very participative person in academics as well as in business, which is very rare. Some people spend their time only in the realm of business, and some people only in the realm of academics. But doing a blend of both academics and as well as business is something which I would attribute to Ranjit Puranik ji and his visionary leadership, especially in continuing the great legacy of Ayurved. So congratulate him for all his efforts, endeavors, and also the contributions in the field of Ayurveda. So Mumbai has a lot to offer, especially Maharashtra has a lot to offer in furthering the cause of Ayurveda, especially the traditional scientific aspects. So with this, and also offering him thanks for having considered me for this. I consider this as a very special honor, looking at the galaxy of speakers who have been there in this. So I don't know if I will be able to do some justice, but at least I will try to, put across certain things that might, be of much importance, especially when BL Gaur sir is there. In some of the interactions, he also offered, we had requested him to actually come over to Bangalore to enlighten us on these, on many aspects, which to which he had also agreed. So we are looking forward some opportunities to get him, to get his blessings as well as his advice. So without wasting much time, I would like to go ahead. Um, I thought I will put in certain aspects in mental health and neurosciences, the integrative health perspective of Ayurveda. So what I'm going to do in the next few, in 30 or 40 minutes is trying to uh, I will try to give a sort of overview of the state of the art, or at least the contemporary views and the directions which we might be uh, inclined to take in the field of mental health and neurosciences, in Ayurveda especially, and what is the position of Ayush in general and Ayurveda and yoga in particular. So I'll just try to throw some light on this. So let me begin with this concept of integration that has happened. Um, Okay, now I will just try to throw some light on what is this concept of integration that we are talking of, and how this is possible. Now, it's a sort of this is wholly the Nimhan story. And in mental health and neurosciences, Nimhans pioneered the uh, establishment which looked at generating knowledge and execution of clinical services, as well as training in this field through the Department of Integrative Medicine, and then by following certain models which were very unique and stands unique even today. So I would say that the concept of integration now is known to everyone. We have a lot of integrative associations. We have a lot of initiatives in integration that we see. But what we did was a little different from what is generally known about integration. And also, there are many miscommunications or misrepresentations of what integration would mean. So I thought we'll just put in some kind of clarity on that. So it's a sort of what we have tried to do is to engineer what to the concept of specifically to engineer the concept of integration, the design and the build. Now, we know that a particular clinical condition requires a certain kind of treatment. So when you look at a comprehensive management plan, so one approach is not sufficient. It used to be might not be sufficient, but now everyone knows is not sufficient. There has to be multiple approaches. In fact, many even the modern medical science or modern bioscience or any other discipline, if you look at, integration has become a part and parcel. So you have uh, people trying to integrate everything together so that the person gets a comprehensive care. So here the actual philosophy was to get in all the best, whatever is available best on all practices. And then if those can be complementing to each other and holistic. See, what happens is people start thinking, especially when we say that we have these systems, and then we offer services in these particular systems, multiple systems. The commonly asked question is that, why should I take medicines from different systems of medicine for the same disease? Will I not be overdosing myself? Will I not be treating redoubling, or will I not be doubling the therapeutic efforts? And will it not be harmful to me? This is the first question that the patient asks. And second thing is that is it necessary? So these are two things that we actually spend some time in convincing the patients why it would be necessary. Now, the basic premise of being able to complement or being able to integrate is the way is how the whole concept acts. Now, when you look at any particular disease, the biomedicine looks at the biological pathways. I don't say that Ayurveda or any other system doesn't follow that aspect, but that is not the only primary aim of the sciences. Now, there is something which the action of a particular drug has can be studied in multiple pathways, but then there is one particular approach that can complement or can help the pathway correct itself, and in the process the pathophysiological or the derangement which is seen as a part of pathology can be corrected. Now, this concept of being able to complement exists in the Indian systems of medicine, especially Ayurveda. And that is what we call as holistic, because a lot of people talk of what is holistic, and so on. But what is this holism is something which is very important. Now, what we are trying to figure out is to see and explain if we can say what holism would mean. And if we actually dwell into the concept of holism, it actually is a discipline by itself. Now, what is holism, as we understand, is you look at the whole body as one, etc., and etc. But then, are we able to explain it in terms of scientific pathways? Is something which is very, very challenging. Now, let's say, for example, if there is some disease that we are handling. Let's say we are talking of depression, and we are giving some medicines, let's say some Ayurveda therapies. Now, how is it acting is something which actually generates a lot of interest as to, because we are not giving serotonin reuptake inhibitor. We are not giving any other neurotransmitter that is going to elevate the mood. We are not giving those. But then there is some effect that we are seeing. So that is a part of the whole thing. But then what are the other areas where it is acting? And then how is it complementing the biomedical pathways that are happening? So this actually forms the crux of trying to understand what is holism. And also giving a definition of holism and how this is very relevant to the concept of integration is something that every one of us should address. Now, why integrative medicine? One is try to find out the biology of neuropsychiatric disorders and also plan a comprehensive treatment for neuropsychiatric disorders. Now, these are two important domains that we would like to sort of initiate knowledge generation in these areas so that we actually explain what is the concept of integration. Now, what happened with the Nimhans model is the the model that we follow. Now, currently we have the integrative treatments available in most of the premier institutes as well. So now the things have changed. 20 years before, we couldn't think of, but then now we have all the aims hosting the Ayush departments and so on. Now, the approach currently that is very commonly seen, except a very few places, is that the patient's choice. If the patient wants to get treated from multidisciplinary team, then he can select what he wants to do. This is what is existing. Now, what we did was, and that is known as cafeteria approach. Now, what we did in terms of systemic integration was the the psychiatrist, the Ayurveda expert, and the yoga expert, all of us, we consult the patient at the same time, which means a particular disease and the treatment is optimized by the experts, and the patient is not left to himself to decide what he wants to take. Now, what, how much, and to what duration is something that we plan, and we help the patient take an informed decision. Let's say I'll give you a very simple example. Let's say there is a patient of mild depression. So the all three of us sit together, and then we would actually, in such case, in any case that we find appropriate, we would say that only yoga might be sufficient for this person. So we will advise him that you will not need any medicines. You please take yoga and go. After a month or two, if he improves, fine. But if he doesn't improve, then supplement his yogic practices with some kind of Ayurveda medicines and send him back. Comes back. If he is doing well, fine. If he's not doing well, or if he is deteriorating, then we add, let's say in severe depression, let's say the patient comes to us with mild depression but has progressed into severe depression, and then that is a time when we will have to give him antidepressants or sometimes antipsychotics. And while doing this, he will not be able to do yoga because he is debilitated. He is not in a position to do it. So we withdraw Ayurveda and yoga. We tell him that no, you just take this pill, don't worry. Then after he goes back, maybe in a month or two, he settles down. And after that, when he settles down, then slowly the antipsychotics and antidepressants are withdrawn. And then the yoga and Ayurveda is restarted. And after some time, even Ayurveda is withdrawn. And the patient goes on to the patient goes on to take only to do or to follow the yogic principles without any medicines. And what we found to our experience is that some levels of confidence is adding to his healing loop. Now, what is happening is now I am able to manage myself without any medicines. I have been able to discipline my lifestyle. I have been able to manage all the health concerns that I had in terms of my mind. And this confidence actually boosts his, ability to heal by himself. And that also is adding up to the healing processes. So this is one of the experience that, I thought I will share as to how this, complementing helps. Because, the most common questions when you look at, see, all of us know, क्या मैं ये ले सकता हूँ, इसके साथ मैं दोनों ले सकता हूँ, दोनों लेने से मुझे कुछ प्रॉब्लम होगा या नहीं, अगर होगा तो मैं किसके पास जाऊं, आयुर्वेद डॉक्टर के पास जाऊं या एलोपैथी डॉक्टर के पास जाऊं. एंड अगर मैं जाता हूं या इवन द फिजिशियन, देर ऑल्सो वी डोंट नो, अगर आपने उनसे लिया है तो उनसे पूछिए. मैं तो अपने मेडिसिन के बारे में बोल सकता हूँ. सी, running from pillar to post happens to the patient as to where I should go, what the kind of accountability I go there, and there are everyone and all of us addresses, gives a kind of security to the patient and helps also interdisciplinary talk between the experts also. Now we have psychiatrists who are with us for 4 or 5 years, and they understand what virechana is, and in fact they only talk to the patient. आपने विरेचना लिया, कितना वेगा हुआ, आपके वेगास कितने हुए. So this is something which the allopathic psychiatrists are asking the patient along with us, because they know what is a virechana and what is to be expected. So when when a scholar says that there might be, I'm planning for vamana, the psychiatrist, people from the psychiatric discipline are asking, आप वमना क्यों दे रहे हैं, यहाँ तो पिता का पित्ताधिक्यता है तो आपको विरेचन देना चाहिए. This is the kind of familiarity with the concepts that the allopathic doctors are getting used to, and they understand when the patient is giving the feedback, or when they're looking at the patient responding, they know what is happening. So this is causing the inherent or an automatic crosstalk between the physicians, between the experts, and then the concepts of yoga and concepts of Ayurveda is so much getting blended among the experts and also among the patients. So this is another advantage that is happening, and slowly this is evolving into knowledge generation as to, did the patient come with some, if something is happening, should we look at some kind of drug interaction that might be happening, or should we alternate the management strategy? These things also happen, and then this gets into formulations, and this formulation gets into the training. So when we train, the students, either MD Psychiatry or MD Ayurveda. So we see that, this crosstalk or this interdisciplinary interactions happen between. So the MD Psychiatry also might start looking at, or they start talking of, what is happening, and why don't we give Virechana and so on. So this is a change that we are beginning to see. And many a times we have seen that, some of the treatments are able to produce serendipitously certain changes that, has been very, very useful to the field. Now, let's say we were treating a patient of schizophrenia, who was actually a treatment resistant person, treatment resistant schizophrenia, and then we gave him Virechana. He was on clozapine. Now, his blood levels of clozapine was 1600. It's almost toxic. Now, this can lead to, many, difficulties like seizure and other things. So the medicines have to be stopped. So this could not be possible. So then after Virechana, we saw that the serum levels of clozapine considerably reduced. It came below to 400, which is among the safe levels. So, which means that in patients who are on, let's say, mood stabilizers like lithium or clozapine and so on, we can tell the, psychiatric practice that with Virechana, they can maintain the optimal levels, serum levels of the drug, and help the patient not go into toxic levels. So, this is what we are talking of, how integration might be possible, wherein how certain treatments can go together and in fact help the patient to a very great extent. And the another example was that, we started giving Triphala to patients who were on antipsychotic induced metabolic issues. Let's say obesity, let's say amenorrhea, and, related metabolic issues. So this is a very common complication in people who are antipsychotics. Then, the psychiatrists themselves said, "अरे इसके लिए कुछ करो यार, देखो कुछ कर सकते हो." To our surprise, with Triphala, with which we gave along with the antipsychotic medications, we saw that the weight gain stopped in 2 or 3 months. There is a plateau that the patient achieves, and then in some people 1 or 2 kgs came down also. This was a PDF study, and we just recently published this. And then there was another PDF who was a PDF psychiatry, and she worked on, giving some Ayurveda supplements to female patients who had amenorrhea due to antipsychotic medication, which is a very common complication that happens. The optimizing the patient's symptoms in such a way that the functionality is maintained is one of the objective of the treatment. So the patient is on antipsychotic medication, which means that the patient's functionality has improved. The patient, if the woman was working, she can go back to work. She can have very good relationship with the social relationships, family relationship, all this she can nurture. But then if she wants to raise a family, it's also very important. Now, what we saw was with Ayurveda supplements, the patient started getting their periods back. So this is a sort of what we can say is treatment emergent complications and how we can sort of address them. So we can see this, going together as to, let's say, if a patient is being prescribed an antipsychotic like risperidone, the THP, the trihexyphenidyl, is given along with him to prevent the EPS symptoms. And then what if we are looking at a scenario where antipsychotic medications can be given along with Triphala, so that the metabolic effects can be minimized to the patient. So aren't we now talking of kind of integration here, wherein, the patient is being benefited, because metabolic syndromes are extremely difficult to handle. Over a period of time, we know what all it can cause. And then with antipsychotic medication, the patient has to be maintained functionally. And then, also see that the patient doesn't get into more difficulties. So these are some of the examples that we have sort of found that an ideal integration could happen in this way. So along with the process, what we did was, now I would like to present only the studies that we did, because concepts we all know. So this is wherein we actually gave a perspective to what is integrative medicine, and then how it can be considered as a medicine, and what the perspective is in terms of various other domains. You just type integrative medicine on Google, you can see multiple results coming up. And there are so many concepts that are happening, wherein an integration would mean just multidisciplinary approach. What we are actually trying to do is a multidisciplinary approach, wherein we are trying to integrate systems of medicine, looking at, after having studied the basics of the basic philosophies of their mechanistics, as to how they can be, the first question that they should answer is, can they integrate together? A neurologist and a physiotherapist can integrate effectively. Can an Ayurveda and a neurologist integrate effectively, is something which we are trying to generate evidence. Now, without evidence, it would be very difficult to for people to actually accept or go forward. So generating evidence becomes important. So multidisciplinary approach in a particular setting would mean that a comprehensive care is being given, and it can vary from setting to setting. In a neurological hospital, it can be a physiotherapist, a neurologist, a speech therapist, and so on. They integrate together. In a psychiatric hospital, a psychiatric social worker, a clinical psychologist, a psychiatrist, all these people can integrate together. So we have to find out the niche of how develop an integration which has the systems of medicine like Ayurveda and yoga getting integrated into the modern biomedical practice. Try to find out where there are lacunae, try to find out where we can actually complement and do it. Nobody objects, everyone accepts with open hand. And our experience has been contrary to what we assumed, that we might be faced with a lot of hostilities and so on, but then open arms, we were accepted. Only thing is, all their apprehensions had to be addressed, and we know what their apprehensions are. We've been reading, and instead of just trying to fight it out, go to them and explain, this is how, what it is. All the fears are allayed, and acceptance is open armed acceptance. So this is something which has been our experience. And then we later went on to the CCRS itself went on to publish another article, wherein we it was an invited article, of course. The inspirations of our honorable Prime Minister, who was talking of one nation, one health, and then how that precepts, and also that inspiring words, what are the initiatives that has happened. So we actually gave a sort of framework as to how we can think of one nation and one health through integration, as to trying to identify the lacunae, trying to identify the treatment gaps, and fill in by whatever is available using best of systems. Is then we contributed to that article. And then we also envisioned and tried to make a roadmap of how to start the concept of integration, because the biomedical training is in such a way that they don't get an exposure to learn or understand, or at least know about what the philosophy, what the fundamental concepts of these traditional systems of medicine is. So that is a major roadblock. So this is the problem is that there is lack of information, and if we are able to provide that information, so the first thing that can be integrated is yoga, because there is no problem, there are no pharmacological interventions there, and everyone is now very welcoming to the role of yoga in healthcare, and then they do it. And when people start looking at, people start experiencing very good changes that are happening, very good benefits that the patients are receiving, that is when they start getting how this might be working, and then their acceptance to other systems like Ayurveda, maybe it Unani or Siddha or any other system of medicine, it starts increasing. So yoga can be the first way to start the process of integration, and then bring in the other systems of medicine to fill the healthcare. And this is what we highlighted in the article. So just some findings that we have done in terms of mental health. This was a review article where we actually focused on how narrative is very important in mental health, and how that narrative gets nurtured into, and then also gets transformed into a healing strategy or a process, especially in India. So there are a lot of other aspects that we have covered in this article, which was published in Lancet. But then actually what I would like to highlight here was what we saw when we looked at mental health care in India is there is a very strong, emphatic cultural association with mental health care. Any place, we have also reviewed many articles from Maharashtra also. When we saw that when you have a patient with mental health care concern, you tell them that the patient might be suffering from a mental illness, and this illness might be actually triggered by some kind of neurotransmitter disarray in the brain, and this will be, this is a narrative that no one will accept. They will actually, it is counterproductive when you talk about them, but talk about such kind of scientific aspects. They do it over a period of time, but then this narrative is something nobody accepts. Now what we saw was when the commonest connotation given to mental health concern is that the person is all right, but there is a force which is making him to be not all right. This is in a narrative which the families nurtures. Then there is a supernatural connotation to God or to the Kuldevta or something, wherein they say that some kind of bad force has affected my son or my daughter. Now, there is somebody who will help this go away. So when you say that the person is all right, मैं ठीक हूं, कोई और मुझे जो है इस तरह बिहेवियर पे मजबूर हो कर रहा है, तो अगर ये बैड फोर्स मेरे से निकल जाता है, सो आई विल बिकम ऑल राइट. दिस नैरेटिव इज वेरी स्ट्रांग. अगर आप इसमें कुछ भी मेडल करना, इफ यू डू एनी मेडलिंग इन दिस, they will say that no, doctor pata nahi hai, he will go away, he will not come to you. And this narrative, taking this narrative along with the patient and its family is helping. So you can see that the whole family, agar the whole one family, and there is a family member who's not feeling well, has a mental health concern, and then you say that there is some kind of a bad force which has gotten into him and causing this to happen. So let us all get together and do all those rituals which can drive off this force. So we suggested in the article that there should be a community health of psychiatry. There has to be a collaboration and a multidisciplinary integration with the ritualist, with the priest, and with the psychiatrist and psychiatric social worker, also the psychologist. When all of them work as a team, it helps. So you have one particular home, and that is affiliated to a particular temple. This family goes to that particular temple, and then in the temple, that the priest or somebody says that this is because of ऐसे कुछ हुआ है, तो इसलिए एक bad force है जो इनके अंदर चला गया, उसको निकालने के लिए ये सारे चीज आप कीजिए. देन उसके जो all the relatives, his father's brothers, mother's sisters, everyone gets together. Okay, let's all help the whole thing. So there is this community in psychiatry perspective. There are some rituals that are to be done. There are some temples to be visited. Along with that, take him to some physician or something. The recovery is much better. There is a collaborative effort in helping the patient. So the how culture influences mental health care, and how this culture should not be alienated while a treatment was a very important message that we gave through this article, and how that has been managing the mental health care of the country. See, we have in India not more than around 7,000 psychiatrists, and maybe for such a huge population, you can imagine how the whole psychiatric or the mental health care is being managed. It's quite surprising. There are so many institutions, so many informal cultural institutions in the country which is managing. So this is something which we came, and then we went into a little hardcore, original database research, where we tried. This was the first of its study, which was, of course, supported by the CCRA's Ministry of Ayush, Government of India, where we actually tried to come out with the effect, not only of the effect of the Ayurveda formulation, but we also here came out with another result, that there is mechanistic modulation that has happened. The autonomic nervous systems, through the heart rate variability, we saw that the autonomic nervous system is modulated in such a way that along with the amelioration of the symptoms of depression, the system inside was also getting all right. The sympathetic activation was going down, the parasympathetic activation or the parasympathetic activity was coming up, the hormonal levels were also getting harmonized. So these were some of the mechanistic data that we came out with, and for the first time we published that. And then we saw that how this could be different. Differential effect of Ayurveda when compared to the TCA. The tricyclic antidepressants are the gold standard treatment for depression, and Ayurveda also, and both of them were able to bring down the symptoms of depression, ameliorate the symptoms. But then, was there any difference in the way they acted? What we saw was the Ayurveda therapies actually not only brought down the symptoms of depression, but then in terms of the autonomic functions, the sympathetic activity came down. Now with TCA, it's tricyclic antidepressants. They are anticholinergic, so there actually the sympathetic activity increased, because that is the nature of that particular drug. Whereas here, apart from the disease coming down, there was a harmonizing, there was a kind of restoration that was happening in terms of the autonomic symptoms. But to get the effect, the Ayurveda treatment took 2 months for to initiate the some kind of effect. But then TCA could elicit, we could elicit the effect of TCA in in 3 weeks or so. So this was a kind of difference. But then mechanistic differences in terms of how Ayurveda treatment works when compared to the other kinds of treatments that work is an important contribution, should be an important contribution, because now the psychiatrist started looking at, okay, there is some kind of effect on the autonomic nervous system with this, and there is a differential effect with the Ayurvedic treatment, and also the when compared to the gold standard treatment that is happening. So what is an ideal kind of treatment? Ideal treatment would be something which can also, now we see that depression or any mental healthcare concern, or like depression or so on, has a direct effect on the heart. So we have that the patient suffering from depression can get into cardiovascular dysfunction, can have cardiovascular issues in a period of time if the depression is not addressed adequately. So this connect is something which we are trying to find out. Similarly, this was also done by my colleague at NIMHANS when we started looking at the efficacy, clinical efficacy of Manasamitra Vataka in general anxiety disorder. Along with that, we also looked at the sleep architecture, and what we saw was Manasamitra Vataka actually produced changes in the sleep architecture, and that is how that was one of the effects that was actually normalizing the persons, because benzodiazepines are given in general anxiety disorder. Now, it also enhances the sleep, but then the quality of sleep, which is actually triggered or which are actually initiated by benzodiazepines, are not appreciated by the psychiatrists also. And that's what they say, that if the in general anxiety disorders, if you try and try and see that the causes for anxiety are neutralized, that is the best way to treat, rather than putting the patient on benzodiazepines or anxiolytics, because the quality of sleep is reduced although the patient sleeps. So and second one is the habit forming or dependence that the patient actually gets into when taking benzodiazepines. So that is an area which is extremely now looking for newer kind of management or management strategies in anxiety disorder. So what we saw was the quality of sleep measured by the polysomnography sleep architecture, the first of its kind study that we did, and that was being that got improved along with that. So there is a kind of what happens in terms of clinical efficacy, and also insights into what might be the mechanistics, and is this mechanism ideal, or should there be some kind of modulations there. These are the insights that we get into in these kind of studies, and this was very recently published. And also currently it is catching lot of ground. Integrated yoga, you give yoga alone or Ayurveda alone, or both of them, in negative symptoms of schizophrenia. My experience here says, with all the psychiatrists here says that in psychotic disorders like schizophrenia, be it positive symptoms, it is easier for us to handle if the patient comes with the positive symptoms. Positive symptoms schizophrenia is a presentation where there is a lot of activity, where there is a lot of rajas in the patient in terms of his behavioral manifestations. In negative symptoms, there is lot of withdrawal, social withdrawal, alogia, there is loss of lack of communication, keeping the person keeps to himself, and so on. So in negative symptoms, the response to the conventional antipsychotic medication has not been so good. So they say that there is a lot of gap in this area, and please try to see if you can help. And we published this case series of 6 patients who we treated with along with their treatment as usual with Ayurveda and yoga. There was excellent response in negative symptoms, and now we also get referrals from the psychiatrist if the patient is having predominant presentation of negative symptoms. They are referred to us for treatment. So this is another change that we could do it. And apart from that, we have initiated many other research projects, and currently we are trying to evaluate the effect of Ayurveda intervention in pediatric attention deficit hyperactivity disorder. We are seeing that the child and adolescent psychiatrists who treat these patients, they are now calling us, they are discussing with us. They say that patients are responding better with the Ayurveda therapies, and then we are trying to work out how an integration can be possible. Instead of giving us, they say that giving whatever the very limited approaches in terms of conventional management of ADHD, what we give is only kind of medications that actually doesn't help much. And if you are able to help, it'll be it'll be very desirable, is what they express. Of course, this project has been funded by the Ministry of Ayush, Government of India, and then we are getting very encouraging results. So this was the manuscript which has just been accepted where we saw, Ayurveda intervention as an integrated management with the conventional antipsychotic therapy for management of metabolic syndrome. And there are two, MD theses, small MD research that we did with Vamana and Virechana Karma in negative symptoms of schizophrenia. Just finished. This is an unpublished data. We are waiting for the manuscript to be reviewed. So here we looked at, patients predominant with the negative symptoms with Vamana and Virechana and comparing with the treatment as usual. We looked at heart rate variability in terms of autonomic nervous system functions, and we looked at the heart rate variability and also the clinical symptoms. And what we saw was nice. We saw that the patients responded significantly better with an add-on Ayurveda, Vamana and Virechana when compared to the treatment as usual group. The effect size for clinical improvement was large effect size, and then medium effect size. This also reduced the inflammatory markers like the C-reactive protein, and then also the autonomic parameters like the time domain parameters of RMSSD in the autonomic function. So this was in the heart rate variability. So this was very encouraging for us. The another study that I would like to present was looking at another MD student of ours, a pilot randomized control trial evaluating the effect of Virechana. There we looked at just serum neuroinflammation, and here we looked at neurophysiological parameters as well as immune parameters. Now here what we found was we looked at treatment as usual, and we looked at patients along with treatment as usual. Virechana was given, and then we saw that the clinical outcomes, apart from clinical outcomes and CRPs, we had there was a modulation of neuroinflammation. The cortisol levels came down. That was a further improvement on the previous study, wherein the serum cortisol levels came down significantly. So then we saw that the mechanisms is not only working at the autonomic nervous system level, it is having a further reflections on the HPA axis, and also further reflections on the neuroimmune and other neuroinflammatory parameters. So this is, a few of our studies on mental health. In terms of neurosciences, it has been quite a good experience with us, and we know in stroke rehabilitation Ayurveda works very well. And here we looked at cardiac autonomic dysfunction. Also started, there is a harmonizing. So what I would like to highlight here is, yes, we know in stroke things improve, but then there is a harmony which is happening inside, is something which is to be highlighted in terms of mechanistics of the active, the the treatments with Ayurveda. And this was another case report that we saw, was the management of tardive dyskinesia. This is a very good experience for us. What has happened is that when we saw that there was a patient who was on antipsychotic medication, the conventional antipsychotic medication, and then the patient was also taking Ayurveda through some other Ayurvedic treatment center. But then when he came to us, then we saw, we modulated so many other antipsychotics with the help of the psychiatrist. But then the patient had, strong manifestations of EPS, extrapyramidal symptoms. And then we saw that, we stopped the Ayurveda medicine also in the whole process. Then his, extrapyramidal symptoms came down. So that is when we realized that there are some Ayurveda medicines which can also have potential side effects. And these side effects can be very debilitating also. Then the other thing, this was the first thing that experience that happened. And second thing, what we saw was we saw the, tardive dyskinesia is very commonly seen in patients on antipsychotics. And then we started, using some logic and started supplementing some Ayurveda formulations along with that. And we saw that the tardive dyskinesia could be effectively managed, or there was actually, we saw that in 6 months' time, the patient was able to overcome almost all the symptoms, around 90% symptoms of TD. I'm not revealing what the medicines were because it's part of the publication, but then this has been our experiences on that. Another very good thing that we could during the process was in the management of cerebellar ataxias. We can see that the balance and the progression of the cerebral, it's a very debilitating disease. The patient develops ataxia, and then the involuntary movements are so much that the regular functionality of the patient is severely affected. And we saw that with an adjuvant therapy of various of all the therapies that we generally give, there has been a very good response that we could elicit in degenerative ataxias. That was in terms of the improvement of balance, and this was in improvement in the fall risk, as well as postural stability in SCA 2. This was also reported, which we saw during our experience here. Then most of the neurological kind of publications that we have had, we have just reported what we have seen. What makes us a little different here would be that we will have to be working very closely with our neurological counterparts, which means that we will have to answer a lot of questions that are being posed to us in terms of how this medicine and why this medicine. So this is what makes our job a little more tougher when compared to an independent practitioner. So that's how. But then we were able to sort of publish this report where we talked, where we managed the GB syndrome, which most of us know how to manage, but was a good experience here. And then this is something which also we have been handling patients suffering from Duchenne muscular dystrophy with association with the neurology department here. And we have seen, we have some patients who keep coming us, and there have been patients since the past 4 years have not yet become relegated to the bed. They're still ambulatory, they're still walking, maintaining a good quality of life. I'm not saying that we were able to reverse the process, but the progress has been sort of delayed. We've seen that the patient's ability, functionality is still maintained. Most of us might have had this experience, but then we have NIMHANS is a recognized center for Duchenne muscular dystrophy, and most of the dystrophies, we have something known as dystrophy clinic here. This I'm talking, I'm just trying to give an information in terms of what the neurology department does. It's a huge neurology department of the country, and it's a recognized center. And we were able to sort of get a good chunk of the children with the DMD. And we have seen that in the left, this is how the quality of life disease progression goes, and with our treatment we have been able to achieve a plateau and sort of arrest the progression of the disease. Was interesting, and so I thought I'll just present. And this is another thing that we have has been a little unique to NIMHANS. We were able to generate, very few institutes have animal models of Alzheimer's disease. So these are the animal models that we were able to generate, and we have treated the rats. This is the cross section of the dentate gyrus of the brain of a mice. So here we are looking at the beta amyloid deposits, and with the treatment of Brahmi and Mandukaparni for 14 days, how the whole thing has gotten cleared. especially with Mandukaparni, has been able to produce very good effects. So this is still unpublished data. I thought, to share this information with you. In the next few days, we will be publishing this. We will be getting it in the animal models in terms of getting some evidence with how Brahmi and Mandukaparani might be working in Alzheimer's dementia and many other, memory, mild cognitive impairments that patients develop due to aging or otherwise. So, maybe trying to look at the kind of scientific demand that we face, it might be important for us to address and also come out with information on many mechanistic things that might be happening, define what is holism, and decipher various pathways that might be involved and how they can be actually complemented is, I think, might be a responsibility of people working in institutes, especially academic institutes, so that the students uh, who are learning, or the students who are interacting with people, can stand shoulder to shoulder with the modern biomedical scientists and tell them that, this is what we are looking at. Let's say, for example, we are giving Basti, would mean that we are looking at gut brain axis and also looking at neuroinflammation. If neuromodulation, we know that gut dysbiosis is leading to neuroinflammation, and gut dysbiosis, addressing gut dysbiosis has been now in the domain of science since a very long time, in terms, especially in neuropsychiatric issues. So addressing gut brain axis is something which we are doing, is trying to put, what we have been saying, with, in conversation with the modern biomedical scientists, and find ourselves relevant in terms of generating evidence and making a. We are not here, or I'm not saying that we have some kind of a burden on trying to prove anything. I'm saying that the burden is on us in terms of trying to explain how this might be working, so that I am called and I am able, people engage with me in conversation, in scientific conversation. And and in this era of Google, you have a patient who's coming to you, is talking a lot of things on this, and then we will have to be at least, giving him some kind of explanation, so that he gets convinced with, and there is a larger acceptance. The student levels in understanding these aspects increases. So this is what I'm trying to convey in terms of message. And neuromodulation is one of the concepts. Let's say we give Brahmi, Mandukaparani, Shankapushpi or something. Is there some kind of molecule that is getting into the bloodstream and going into the brain and modulating a neurotransmitter? Is one pathway which is yet to be studied. But then what we have seen is a patient with neuromodulation responds better. So you might have heard of transcranial direct current stimulation, transcranial magnetic stimulation. These are all stimulations or modulations that actually help. They are used to actually improve the brain functions, improve some deficits in the transmitters, and see that the patient improves. So what we are seeing is, with yoga, there is some kind of neuromodulation that is happening. And with Ayurveda, we are trying to look in those eyes, as to, there can be some kind of neuromodulatory effect of the Medhya Rasayanas that is producing. Because what we are seeing is, when we are doing an add-on, it might be that this medicine also might be working, but it might also be that it is actually synergizing the efficacy of the antipsychotic or any other antidepressant, which is a modern biomedical based kind of a therapy that the patient might be taking. So both of this might be possible in terms of getting the benefit. I'm saying that, among the mechanistics, we might be looking at those aspects. And we're trying to also look at doshic brain and brain network. If we are able to find out various profiles and signatures of brain networking based on prakriti, or based on various Ayurveda concepts that we have, and also look at epigenetic signatures in human beings with prakriti and so on. Is it possible to prognosticate? Is it possible to give us give evidence based prognostication, or pharmacogenomics effect of a particular medicine? These are some of the areas where research can actually help in generating a lot of knowledge, in giving a lot of evidence in terms of the actions. So this is the research effort that we are currently pursuing, of course, funded by the Ministry of Ayush, Government of India. With a lot of gratitude to the ministry, we are looking at four disorders: schizophrenia, Alzheimer's dementia, mood disorders, and multiple sclerosis. Two are psychiatric disorders and two are neurological disorders. Trying to look at genomics, trying to look at neuroimaging, gut microbiome, as well as immune parameters establish. We have we have designed three cohorts. One is normal healthy controls, second is patients, and the third is the first degree relatives of the patients, trying to look at if there are markers that can actually try and classify these people, so that the precision of diagnosis as well as prognostication can improve. So we are looking at clinical trials as to to decipher the putative mechanisms of action. We are looking at deep phenotyping in these cohorts in terms of prakriti. This project also is generating PhDs and MDs, and also trying to develop the first digital biorepository of doshic brain. These are the other potential areas of collaboration where integration. I just spoke about mental health and neuroscience because that is our domain. There are various other areas which the august audience is already aware of. I thought they'll just put this now. These are some of the challenges that we will have to address. The in integrative or development of integrative approaches, the department identifying potential areas, faculty suitable and mainstreaming the department, how the departments can have crosstalk and come up. Now we have been now able to initiate 5 academic courses, postdoctoral fellowships for MD Ayurveda and postdoctoral fellowship for MD Psychiatry, postdoctoral fellowship in integrative medicine, PhD in integrative medicine. These are three. And we also run MD Manovignan and Manasarog. That is the flagship program. Our first batch just came out this year. Now, what they do, it's not MD integrative medicine, it is MD Manovignan and Manasarog, which is as prescribed by the NCISM, because the MD integrative medicine, the concept is not yet in vogue. Nobody will take them for appointment. So, although they know that they're not empowered to write prescriptions of antipsychotics, but they will what how they are unique is that they will know at what stage of the patient they are seeing the patient in terms of the antipsychotics, in terms of the side effects of antipsychotics, in terms of varied presentations of psychotic disorders, not only psychotic disorders but also the other kinds of disorders, and then what medicine or whom to refer and how integration can be possible is the knowledge that they will have. And they are most fit now to currently develop crosstalk and an interdisciplinary dialogue with another psychiatrist, and to develop a community health of practice in terms of treating the patients of suffering from psychiatric illnesses. Now, yeah, these are some of the things which we have already discussed. The two important challenging things that what we are facing now currently is Journal of Ayurveda and Integrative Medicine is Ayu is another one, and there was one Ancient Science of Life. So effectively, we have JIM and we have Ayu. Only two journals which actually are indexed in the National Library of Medicine. Although we have Ayush portal, what enhances visibility is when you are indexed in a contemporary competitive indexing platform. So when I publish my article in a PubMed index journal, I get a lot of queries and I get more of interactive things that happen. Now, if I send my article to any of the journal, they are finding it very difficult to publish, and and that too it is going from NIMHANS with lot of state of the art parameters, and still we are facing a lot of problems. Now I can imagine how a normal Ayurveda college or an Ayush college might be facing the problem. So we will have to try and address this. If our articles are not state of the art with the the parameters which are contemporary, then we are not getting published. And when we are not getting published, and we have we get a lot of students who become victim to predatory journals. There are so many journals which take the articles. They say that they do a peer review, but it is not true. So they just publish. So you have a student who says, poor thing, he doesn't know that he has just published in a predatory journal. So they are falling victim of those kind of predatory journals, because MD students, especially in most of the colleges, in some of the colleges at least, they are, they're required to publish, before they complete their MD. Now, during those circumstances, they fall victim to predatory journals. So if we look at the, very good contemporary publishing or indexing platform and publish our articles there, that is something which the onus is on the young researchers in the field. Yeah, these are some of the safety concerns of which we need to address. I don't want to dwell much into this. Some maybe in some other platform, because I think I have overshot my time. So I come to the end of my presentation on some of the experiences of in neuropsychiatry at NIMHANS. So I can take questions if there are any.
So very briefly, I believe there are three questions that have come in the Q&A. So if we can kindly just see them.
Sure.
I think the first one was from one Dr. Manisha Sharma. What about results in epilepsy, where EEG...
In epilepsy, can we give only Ayurveda treatment if MRI, EEG are normal in a 9-year aged male patient? Yeah, if MRI and EEG are normal, that's a indicative of a very good prognosis. That's number one. Number two, in epilepsy, the most common or the most important thing is unpredictability. So you see patients or children who go into remission, and by God's grace, they continue in the remitted stage for a very long time. So there has to be there is a protocol in the management of epilepsy where the neurologist will say that after so many days of treatment, now I can bring down the medications, and then the patient can be off medication. So there is a protocol. So once that is done, I think we can intervene and give some tropics which can help the patient not get into recurrent attacks of epilepsy. It can be done. But then the most important thing that we should be following is we should develop the connect with the epileptic or the neurologist who is treating the patient. and tell him that this is what is happening. This goes a very long way in reducing the mistrust. If you say that it's okay, you take this medicine, and most of the times it is not the doctors, it is the patient. So what the patient understands, it can be a misunderstanding. And the patient thinks that I'm taking Ayurveda treatment. Why should I take this medicine now? So he stops it by himself. And next time when he goes to the neurologist, he says that मैंने छोड़ दिया है डॉक्टर साहब क्योंकि मैं आयुर्वेदिक ले रहा था. So the mistrust happens with the neurologist. He thinks that this Ayurveda person has misled the patient, and this mistrust, grows. And in more than half of the times, this is what happens. So it is very important to educate the patient and then say that आप ये कर सकते हैं, लेकिन 1 मिनट रुकिए, आप अपना डॉक्टर का फोन नंबर हमें दीजिए, हम बात करेंगे उनसे, आप बात कीजिए. It solves a lot of problems. The same thing, I'm saying out of my experience. He says that, Doctor, see, after now the patient is symptom free since 2 years. Now I am tapering the medications, and the next December he will be off medications. Then you give him some tropic, something that can improve his brain health so that he doesn't get recurrence. So this is something which is surely achievable, and the trust between interdisciplinary trust can maintain. And second question was, we have observed
We have observed TDM levels in Eptoin taking patient changes with syrup Shankapushpi. Eptoin level decrease is this drug interactions. They need more medicine to control their seizure. Each Ayurvedic medicine doesn't show synergized effect. So now do we have to see each and every drug interactions with combinations?
exactly. That's a very interesting finding that you are presenting. Go ahead, please chase it and try to see if it is really Shankapushpi that is instead of giving a synergistic effect, it is reducing the effect of the activity of the Eptoin levels or something like that. It's something I have not had this experience with me still, because we don't use syrup Shankapushpi. We use, we have been trying to look at, trying to use herbs we can trace back to directly, rather than use some proprietary or something like that, so that we know if you're using Shankapushpi Choorna, you can go back to, because you know from where you have collected, you can do an analysis and see all those things. That helps. So try to be sort of certain as to what you are using, and then if this is happening, you will have to chase it. Is there any clinical proven single herb or combination? I'm sorry, what happened?
So
Okay.
we'll take
Combination which can be used either at any stage. Combination present can be used for what? For what? Praveen Kumar Mishra ji. Is there any clinically proven single herb combination at present which can be used in Ayurveda at any stage of? Could you please mention? Are you looking at which any kind of a condition, clinical condition?
So, with your kind permission, we'll catalog these questions.
Oh, sure.
We'll have them sent to you, because I'm sure. See, today, Kishore Kumarji, it's not that we've had thousands of people joining the seminar, but there is a distill of practitioners that have actually come today to
Wonderful.
hear you talk. And of course, I'd like Prajakta to take us through the entire motions and not interfere for the moment. But it was an absolute treat to hear you. So we will catalog these questions and have them sent to you, sir.
Sure.
Right.
Fine. Thank you.
Thank you, sir. Thank you so much for this lecture. We must adopt an integrative approach to increase the efficacy of our treatment. Now I request Vaidya Shyama-Sundar Sharma sir to guide us about the work of Mumbai Vaidya Sabha and few words about Vaidya late Shrimant and Nanasaheb Puranik. Vaidya Shyama-Sundar Sharma sir. Vaidya Sharma sir is a secretary of Mumbai Vaidya Sabha and also decorating a post of senior vice president Maharashtra Ayurved Sammelan. Please welcome sir.
पहले तो मैं क्षमा चाहता हूँ, आरंभ में जुड़ नहीं पाया तकनीकी खराबी के कारण से। आज हम लोग स्वर्गीय वैद्यराज श्रीमंत नाना साहेब पुराणिक जी की स्मृति के व्याख्यान में जुड़े हुए हैं। आप सभी का स्वागत है। नाना साहब, उनको एक सम्मान के साथ में, सम्मान और प्रेम के साथ में उनका ये नाम रखा गया। वास्तव में उनका जो नाम था वो गंगाधर विष्णु पुराणिक था। बचपन में उन्होंने अपने जन्म से ही आयुर्वेद परिवार होने के कारण से आयुर्वेद के प्रति उनकी रुचि बढ़ती रही। उनके पिताजी श्री विष्णु शास्त्री जी वैद्यराज थे, उनके दादाजी वैद्यराज थे श्री कृष्णा शास्त्री जी। ऐसा वातावरण था जिसमें उनको आयुर्वेद के प्रति सदैव लगाव रहा, और धीरे धीरे जैसे जैसे बड़े हुए तो आयुर्वेदिक वातावरण के कारण में उनके मन में भी जिज्ञासा जागी कि आयुर्वेद के प्रति हमें कुछ किया जाना चाहिए। उनकी जिज्ञासा थी और उनके परिवार का जो वातावरण था, पिताजी और दादाजी ने मिलकर के, यानी श्री वैद्यराज विष्णु शास्त्री जी ने और श्री कृष्ण शास्त्री जी ने मिलकर के एक संस्था का उन्होंने निर्माण किया। दूध पापेश्वर जो हम आज देखते हैं वो एक एम्पायर के रूप में देखते हैं, लेकिन ये उन्होंने, जिनका जन्म 1909 में हुआ, उनके पिताजी उनके दादाजी ने ये किया, जिसका नाम उन्होंने रखा दूध पापेश्वर आर्य औषध कारखाना। कारखाना उन्होंने नाम रखा, जहां पे औषधियों का निर्माण उन्होंने आरंभ किया। किंतु दुर्भाग्यवश उनका साथ अधिक रहा नहीं, दादाजी और पिताजी के साथ में, किंतु उनकी रुचि जो आयुर्वेद में थी वो बनी रही। और एक निश्चय किया उन्होंने, और 25 वर्ष की उम्र में, जिनका जन्म 1909 में हुआ और एक 1933 में उन्होंने एक संस्था की स्थापना की जो दूध पापेश्वर आयुर्वेद ट्रस्ट के नाम से जाना गया। पनवेल में आपने इसकी स्थापना की, और धीरे धीरे इसके अंदर जो भी आज हम देखते हैं, जैसे सीएमईज होती हैं, सेमिनार्स होती हैं, आप कल्पना कीजिए उस समय में भी नाना साहब सेमिनार किया करते थे। उनका अधिकांश जो था ये था कि आयुर्वेद में जो उसकी वात पित्त कफ जो त्रिदोष हैं उनके बारे में लोगों को मालूम होना चाहिए, वो किस तरीके से हमारे शरीर में काम करते हैं, किस तरीके से रोगों की उत्पत्ति करते हैं। इन सारी बातों पर उनका ज्यादा जोर रहता था। और सेमिनार में करने के साथ साथ में उन्होंने जो प्लांट्स होते हैं, आयुर्वेदिक जो औषधियां हैं, उनके निर्माण के लिए भी उन्होंने कार्य चालू किया, उनके प्लांट्स को उगाना चालू किया। तो इस तरीके से अगर हम देखें तो एक आयुर्वेदिक वातावरण में जन्म लेने वाले व्यक्ति का आज जो हम दूध पापेश्वर एम्पायर के रूप में देखते हैं, तो उन्हीं से मुझे लगता है कि आज जो हमारे सामने है आदरणीय श्री रंजीत पुराणिक जी, पूरा उन्होंने ग्रहण किया है। और मुझे ये लगता है उन्होंने पूरा ये जो पूरा ग्रहण किया है, वो ये मान लीजिए कि आज मुझे एक गीता जी का श्लोक याद आता है कि आचरण जैसा किया जाता है श्रेष्ठ लोगों के द्वारा, बाकी लोग उसका अनुसरण करते हैं। यद्ददाचरति श्रेष्ठ तद्द देवेतरो जनः स यत् प्रमाणम कुरुते लोकस तदनुवर्तते। यानी जिस प्रकार एक श्रेष्ठ व्यक्ति अपना व्यवहार, अपना आचरण करता है, बाकी जो जन है या जन समाज या परिवार के लोग हैं उसका अनुसरण करते हैं, क्योंकि उनका जो आचरण है वो जो करते हैं वो प्रमाणित हो जाता है। तो वैसे ही नाना साहब ने जो किया, जो सीखा, हमारा आज हम देखें तो रंजीत पुराणिक सर जो हैं वैसे ही लगे हुए हैं आयुर्वेद के लिए, क्योंकि नाना साहब कहते थे कि अगर धन की कमी हो तो आप चिंता मत करो, धन कहीं से भी आ जाएगा। तो आज हमारे साथ में तो कुबेर हैं, तो जो भी कार्यक्रम करने होते हैं ये अपने मन से, अपनी लगन से और इच्छा के साथ में करते हैं। आयुर्वेद में जितना हम लोगों का विश्वास है शायद उससे ज्यादा इनका विश्वास होगा, मुझे ऐसा लगता है। तो अधिक मैं नहीं कहूंगा। अब मुंबई वैद्य सभा का करीब 136 वर्ष पहले इसकी स्थापना हुई, जिसमें हमारे स्वर्गीय गुरुजी श्री रामजी शर्मा, उनका काफी योगदान रहा, उनका साथ नाना साहब के साथ में भी रहा, और उन्होंने भी नाना साहब से काफ़ी चीज़ें सीखी और उन्होंने एक अपनी संस्था का निर्माण किया जिसमें कई कॉलेज बनी और इस संस्था में कई औषधालय बनाए गए। मुंबई वैद्य सभा में आज हमारे सामने जो गुरु जी हैं, हमारे दीनानाथ जी उपाध्याय जी हैं वैद्यराज, उनके मार्गदर्शन में हम मुंबई वैद्य सभा वाले कार्य करते हैं। हमारे अध्यक्ष है राजेंद्र शर्मा जी, कोषाध्यक्ष है विनोद मेहता जी। तो सब मिलकर के हम सेमिनार भी करते हैं, सीएमईज भी करते हैं और कभी कभी औषधियों पर चर्चाएं भी करते हैं। बीच में हमने पूरी एक कॉन्फ्रेंस की थी और इसी प्रकार से हम चाहते हैं कि आयुर्वेद का प्रचार प्रसार होता रहे। और मैं चाहता हूं कि ये जो भी आयुर्वेदिक प्रसारक मंडल है वो मुंबई वैद्य सभा मिलकर के जो कार्यक्रम करते हैं, इस प्रकार से ही आयुर्वेद की वृद्धि के लिए, आयुर्वेद के प्रचार प्रसार के लिए आगे भी कार्य करते रहें। तो अधिक समय मैं नहीं लेता हूं और यही कहूंगा कि जैसे जैसे आप आयुर्वेद की तरफ बढ़ते हैं, आपको इसका ज्ञान भी होते जाता है, प्रैक्टिस करते जाते हैं और इसी में लगे रहें, मैं तो ये कहूंगा। धन्यवाद।
Thank you, sir. Thank you so much. Now I request Sri Ranjit Puranik, sir, to share the key take-home message from the session, sir.
I don't think I'm really qualified to share a key take-home message in the matter, but all I can really observe is that the kind of work that is happening in Nimans, that Dr. Kishore Kumarji very painstakingly has given us only an overview. We can understand the entire 30 years that he has dedicated in Nimans. I do remember we organized the World Ayurveda Congress in Bangalore, and there also, I'm sure his mentor, Dr. Gangadharan, gave us that kind of reception, that kind of support, by which that is always remembered as one of the better World Ayurveda Congresses that physicians and students had attended. So this is the kind of cutting-edge dialogue. Integration is not about bringing allopathy into the entire realm of healthcare, but integration is also very credibly having a scientific dialogue. And I think this is the kind of work Dr. Kishore Kumar, a Kaya Chikitsa graduate from Hassan, has kind of given it a very defining shape. And, congratulations to you, your department. The kind of, you added a new leaf to the word integration today when you talked about integrative yoga also into the entire healthcare. And I hope the physicians listening on this entire webinar have certainly taken that point, because to me, it's a very holistic method in which you have approached it. There is also great amount of take-homes for even Panchakarma specialists, where you have relied very heavily on Panchakarma as well as when you're talking in terms of mental health and treatment. So I think these protocols and the kind of vistas that you have opened up, the international journals that have received your papers and published them, and of course your real-time problems of publishing more and more, these are very much real. But I think, sir, very frankly, we had around 250 or 300 odd participants in this webinar. I think you have laid a foundation and sown some seeds. I'm sure young students like Dr. Prajakta Kohli and many from campuses around colleges in Mumbai and Maharashtra, they will certainly take this to task. And again, thank you very much for accepting this entire invitation. I wish we could have had you in person, because one of the first things I would have done is given you a glass of water. Because, but it's been extremely rich. And, so this function is organized by Mumbai Vaidya Sabha. And Mumbai Vaidya Sabha does celebrate 136 years of bringing about Sambhasha between Ayurvedic physicians in the entire Pradesh of Mumbai. And to me, it's a very rich legacy. Shyam Sundar Sharma ji, Dr. Rajendra Sharma ji, Vinod Mehta ji, we are all inspired by our late, I call him Guruji Sriramji Sharma, as well as Dinanathji Upadhyay, and that is how we take it forward. The other organizer of this entire forum, this webinar, is Ayurveda Prasarak Mandal, a Ayurvedic college established almost 72 years ago. And this college again is right out there talking about the classical syntax of Ayurveda and today has a very admirable record of even having the PG students on board. And yes, the college is a grant-in-aid college. It's dealing with all kinds of challenges that are right up there. You're a curriculum definer in NCISL, so I think you're aware of some of the challenges that are there. But I think the staff, the faculty, the academics, the students, the PG scholars, interns, they're all right out there to ensure that the best is kind of achieved. That's the second organizer. And today we are blessed with Professor B.L. Gaur, an absolute Guruji. You have given him already the pranams, 1,000 pranams for us, because we are the inspired generation from him. And, Professor B.L. Gaur, as he will be introduced, was the first speaker when Guruji Sriramji Sharma asked us to start this memorial lecture in memory of Vaidya Nanasaheb Puranik. And today he is gracing this occasion as president of the function. And a lot has happened since 2001 when he addressed us first. This is the 25th lecture, momentous, milestone, and absolutely deserving speaker. Thank you for accepting this entire matter. And I am sure my grandfather, who donned the mantle at a very young age, he had to, because he had to, it was to be a continuum, presided over the company operations till almost 1968-69. And those were defining moments in Ayurveda. So you had the onslaught of allopathy that's coming in. You had the tradition that had to be kept intact. You had the traditionalists who refused to also change. And he was a manufacturer first, of course. But this is where a personality like him bloomed into the statesman. And this is, to me, the greatest contribution and inspiration that we in Dudh Papeshwar today continue. That ultimately, if Ayurveda as a sector is better translated, better presented in terms of science, yes, we can actually look to those kind of equal kind of interactions and dialogues that we are all yearning to. So I think we moved way beyond the stage of being mere applicants. I think there is enough amount of curiosity from around the world with regards to what is this codified knowledge system offering. So the challenges that come about with that almost every day to every scholar, I think it's lectures like yours and the ancient syntax that even B.L. Gaurji gives us that really give the kind of pathways to that curious mind. Once again, I thank you once again on behalf of not only Ayurveda Prasarak Mandal, but also Mumbai Vaidya Sabha and Dudh Papeshwar for honoring the late Vaidyaraj Nanasaheb Puranik and his entire memory. Thank you, Prajakta.
Thank you, sir. Thank you so much. Now I request our respected Vaidya Professor Banwari Lal Gaur to kindly deliver the presidential address. Please, sir, welcome. Vaidya Professor Banwari Lal Gaur, sir, please request to come on.
गुरुजी आपका कैमरा ऑन करिए. आपका कैमरा ऑन करिए गुरुजी. दिखाई नहीं.
आवाज आ रही है क्या?
बिल्कुल साफ आ रही है सर, मगर आप
अच्छा,
कैमरा ऑन कर लीजिएगा प्लीज.
गुणत्रय विभेदेन मूर्तित्रय मुपेयुषे त्रयी भुवे त्रिनेत्राय त्रिलोकी पते नमः. परम सम्माननीय श्रीमंत रंजीत पौराणिक महाभागा, ये स्वस्य कार्य स्वे कार्यै स्वेषाम अधिकारिणाम कर्मचारिणाम दूतपापेश्वरम अधिकृत्य यत् रंजितम सर्वेषाम मनांसी, सबके मन को जिन्होंने रंग रखा है, चाहे दूतपापेश्वर के अधिकारी हों, चाहे सब कर्मचारी हों, अथवा ये दूतपापेश्वर इति संस्थाया उत्पादकानां द्रव्याणाम औषधीनां च प्रयोगम कुर्वन्ति तेषामपि रंजनम कुर्वन्ति अतएव रंजीत महाभागा पौराणिक रूपेण अत्र राजन्ते। अद्य प्रमुख वक्ता है श्रीमंत किशोर कुमार महाभागा। देखिए आप क्या द्वंद्व स्वरूप है, दो प्रकार का स्वरूप है वहां। द्वंद्व का भाव है, और द्वंद्व का भाव क्या है? किशोर भी हैं और कुमार भी हैं। किशोरोपि वर्तते कुमारश्चापि वर्तते। द्वितीयस्य यद युग्म स्वरूपम द्वंद्वात्मकम वर्तते। दूसरा द्वंद्व क्या है इनमें? राम कृष्णा, रामोपि वर्तते कृष्णोपि वर्तते। अस्मात् कारणात् अत्रापि द्वंद्वत्वम, यहाँ भी द्विविध का भाव है, दो प्रकार के स्वरूप हैं। इन्होंने जो सब्जेक्ट लिया है वो भी क्या है? आयुर्वेद इन मेंटल हेल्थ एंड न्यूरोसाइंस, वहां भी द्वंद्व है, वहां भी दो चीजें हैं। और जो इंटेग्रेटिव है खुद, वह भी द्वैध है, दो है, अर्थात एक प्रधान और एक उसका वैकल्पिक। प्रधान आयुर्वेद हो सकता है, वैकल्पिक एलोपैथिक हो सकती है। प्रधान एलोपैथी हो सकती है, आयुर्वेदिक वैकल्पिक हो सकती है। अब मैं सबसे पहले डॉक्टर श्याम सुंदर जी ने जो नाना साहेब का परिचय दिया, हिंदी में दिया और गद्य में दिया। चरक कहता है, चरक महर्षि चरक कहते हैं, चरक संहिता में कहा गया है निदान स्थान के पहले अध्याय के अंतिम श्लोकों में, गद्योक्त तो सामान्यतया तो कहते हैं कोई भी बात है वो पुनरुक्त नहीं होनी चाहिए, एक बार कहती दोबारा कहना ठीक नहीं लगता। लेकिन महर्षि आचार्य को ये जची नहीं बात, खुद ने कहा था और खुद ने कहने के बाद उनका निवारण किया। और निवारण ये किया, गद्योक्त तो ये पुनः श्लोकैर अर्थ समनुगीयते तद व्यक्ति व्यवसायार्थम द्विरुक्तम तन्न गर्यते। वो कहते हैं कि जो मैं बता रहा हूं, जो मैं कह रहा हूं, जो पहली कही हुई मेरी गद्य की बात है, उसको मैं पद्य में व्यक्ति और व्यवसाय के लिए, व्यक्ति कहते हैं किसी चीज का विवेचन विस्तार से करना, और व्यवसाय कहते हैं संक्षेप में करना। तो कहीं मैंने संक्षेप में करने के लिए कहा है और कहीं पर विस्तार से करने के लिए कहा। तो आपने जो कहा वो उत्कृष्टतम कहा। डॉक्टर श्याम सुंदर जी ने जो वर्णन, क्योंकि उत्कृष्ट व्यक्तियों के सर्वोत्कृष्ट ही स्वरूप हुआ करते हैं। मैं इतने विशेषण उनके लिए प्रयुक्त कर सकता हूं, जैसे ईलित, सस्त, पणायित, पनायित, प्रणुत, पणित, पनित, गीर्ण, वर्णित, अभिष्टुत, ईडित, स्तुत। ये क्यों भाई, इतने क्यों? ये एक संस्कृत का वैशिष्ट्य है कि कई बार आप पर्यायवाची शब्द देखेंगे तो किसी भी चीज को बताने के लिए बताया गया है कि इसका पर्याय ये है, लेकिन ये आप जरूरी नहीं है, आवश्यक नहीं है कि किसी भी स्थान पर किसी भी शब्द को लाके रख दें। अर्थात किसी विशिष्टता का परिचायक, संस्कृत के शब्दों में ये वैशिष्ट्य है कि एक एक शब्द पर्याय होते हुए भी कोई न कोई विशेषता बताता है। तो ये जितनी विशेषताएं निर्दिष्ट की हैं, उन्हीं में यदि हम तकारांत के रूप में तय जिनके अंत में आता है, बुधित, मनित, अवसित, अवगत और विदित, ये भी जोड़ दें तो ऐसे महामना थे वो, ऐसे श्रेष्ठ पुरुष थे जिनके लिए आप श्रीमंत शब्द का प्रयोग करते हैं। श्रीमान, श्रीमंतो, श्रीमंता, संस्कृत का बहुवचन का शब्द है श्रीमंत। और श्री होता है संपूर्ण प्रकार की ऐश्वर्य को, ऐश्वर्य से समग्र से धर्म से यश से श्री, जिसमें संपूर्ण प्रकार का ऐश्वर्य हो, धर्म हो, शास्त्र हो और सभी प्रकार के ज्ञान का स्वरूप हो। ऐसे श्रेष्ठ व्यक्ति के लिए इस तरह का प्रयोग यूं ही लोग नहीं किया करते, अनुकरण यूं ही नहीं करते, क्योंकि कुछ वैशिष्ट्य होता है तब करते हैं। इसलिए जो कुछ आप लोगों ने कहा इसका गद्य स्वरूप में, उसको मैं पद्य स्वरूप में व्यवस्थित रूप से प्रस्तुत करने का प्रयत्न कर रहा हूं। लक्ष्मी श्रीयुक्त कृष्णो जगति विजयताम धूत पापेश्वर आत्मा, धूत पापेश्वर की आत्मा स्वरूप है, प्रारंभिक शरीरेंद्रिय सत्वात्म संयोगोधारी जीवितम का जो स्वरूप बताया गया है। समय मेरे पास बहुत कम है, इसलिए बड़ा अत्यंत संक्षेप में कहूंगा मैं कि इसमें प्रारंभ में जो श्री कृष्ण पुराणिक जी हुए दूत पापेश्वर आयुर्वेद को या औषधि कारखाना के आत्म स्वरूप रहे। आत्म स्वरूप कहते हैं बीज स्वरूप, प्रारंभिक प्रक्रिया जिन्होंने की, वे संसार में विजयी होवे। तत्पुत्रो विष्णुनामा सुजनी अयम अरे, अरे उनके पुत्र जो है विष्णु पुराणिक हुए। और तस्य गंगाधरस्य सुजनीर अयम अरे योसो नक्षत्र सिद्धो दधि नव शशि। ये संस्कृत के पद्यों का एक वैशिष्ट्य है कि एक एक शब्द को जिस प्रकार से प्रयुक्त करते हैं उसके पर्यायवाची शब्दों के आधार पर ये उदधि समुद्र को कहते हैं, ख कहते हैं आकाश को, नव और शशि, शशि एक है। तो इस प्रकार से इनके जो नाम बताए गए हैं उसके आधार पर 1907 में इनका जन्म हुआ। तो अभी शायद श्याम सुंदर जी 1909 बताया था, तो हो सकता है मेरे कहीं गलत पढ़ने में आया हो। लेकिन योसो नक्षत्र सिद्धो दधि ख नव शशि विक्रमाब्दे सुजन्मा नाना साहेब नामना सुप्रथित यश। जिनकी यश की प्रसिद्धि होती है उनका नाम कोई सा भी रखे, नाम संबोधन के लिए होता है। अतः उनका नाम गंगाधर होते हुए भी बाद में नाना साहब के नाम से उन्होंने प्रसिद्धि प्राप्त की और अपने वंश के कल्प वृक्ष के रूप में उन्होंने ये इस प्रकार के यश को प्राप्त किया। नेक्स्ट आगे की इसकी, हाँ जी, अब देखिए कई कई ऐसे श्रेष्ठ पुरुष होते हैं कि उनकी उत्पत्ति मात्र से ही वह स्थान की प्रसिद्धि होती है, पवित्र स्थान हो जाता है। ग्रामे ये पनवेल नामनि सुजनी छात्रा गृह सर्वदा। श्री गंगाधर विष्णु के नाम से प्रसिद्ध जो ये थे, तो इन्होंने क्या हुआ कि वहां पर अपने छात्र जीवन से श्रेष्ठता का प्रदर्शन किया और गंगाधर विष्णु नाम प्रथितो। प्रारंभ में इनका नाम गंगाधर विष्णु, महाराष्ट्र में एक परंपरा है कि स्वयं का नाम और बाद में पिता का नाम। तो गंगाधर विष्णु नाम प्रथितो मेधा प्रभा भास्कर आयुर्वेद जगत पुराणिक वर है। जो पुराणिक वंश है उनमें अत्यंत श्रेष्ठ लोग हुए हैं सारे, किसी को भी प्रारंभ से देख लें आप तो वो सब श्रेष्ठ हुए हैं। और श्रेष्ठ होना में उनमें पीयूष पाणित्व कार्य है, अर्थात सिद्ध हस्त चिकित्सक होने के कारण वे अधिक श्रेष्ठता को प्राप्त किया। तो इस प्रकार से विद्याया से विभिन्न भाग नियता संस्था से प्राष्ठापयत, उन्होंने आयुर्वेद विद्या इससे संबंधित और अन्य बहुत सी संस्थाओं की स्थापना की। ये उनका वैशिष्ट्य ईश्वरीय प्रदत्त स्वरूप था। व्यक्ति को यदि ईश्वर यहाँ जो हम मानते हैं दर्शनों में, भारतीय दर्शनों में, तो किसी विशिष्ट आत्मा को विशिष्ट कार्य के लिए भेजते हैं, तो उन्होंने विशिष्ट कार्य के लिए इनको संप्रेषित किया। नेक्स्ट, इंग्लैंडादि पदे सदा, पद कहते हैं स्थान को, पद कहते हैं पैर को भी कहते हैं, पर पद स्थान को भी कहते हैं। इंग्लैंड इत्यादि अनेक स्थानों पर उन्होंने बहुसो यात्राश्च वैदेश की, विदेश की भी यात्राएं की। और अध्यक्षम कृतवान प्रसन्न वचन है, अध्यक्षता अनेक संस्थाओं में, अनेक सम्मेलनों की, अनेक प्रकार के कार्यक्रमों की अध्यक्षता उन्होंने की। तो श्री गंगाधर विष्णु नाम प्रथितो योग्य सदा हुए थे, हमेशा बुलाया जाता था उनको, ऐसा वंश ख्याति धरे कुलीन निवृ लोकई सदा गीयते, संसार में सदा उनकी प्रशंसा की जाती है। मैं इसलिए कहता हूं ये, मुझे आज मैं अत्यधिक, पुराणिक जी मैं अत्यधिक प्रसन्न इसलिए हूं कि जिस श्रेष्ठ कार्य को आपने 25 वर्ष पहले परम सम्माननीय श्रद्धास्पद वैद्य श्री राम जी की उपस्थिति में उनके सहयोग से, उनके परामर्श से आपने जिस श्रेष्ठ काम को प्रारंभ किया उसका मैं, मेरे जैसा अकिंचन व्यक्ति भी साक्षी बना। पहला व्याख्यान मैंने दिया और आज 25वां व्याख्यान जो आप हो रहा है उसकी भी अध्यक्षता के लिए आपने मुझे याद किया। मैं आशा करूंगा कि जब आप 50वां व्याख्यान करें, जब भी मेरा स्मरण करेंगे, और इसके बाद जब जब कभी भी होगा, क्योंकि आपने श्रेष्ठ व्यक्तियों को बुलाया है, लेकिन फिर भी ये प्रथम अक्षरे आपत्ति, पहली बार जो अक्षर आके पता, BL गौड़ कहते हैं लोग, मुझे मान लीजिए, मैं तो अपना नाम पूरा लिखता हूँ बनवार लाल गौड़, पर BL गौड़ का मतलब पहले अक्षर का महत्व है। एल गौड़ कहोगे तो सब आगे चलेंगे, इसलिए पहला व्याख्यान देने के कारण मुझे अत्यधिक मन प्रफुल्लित है। यद्यपि प्रकृति बाधा अत्र संजाता, प्रकृति ने बाधा उत्पन्न की, लेकिन वह उसका स्वभाव है। प्रकृति कहते ही स्वभाव को है, तो प्रकृति का उसका स्वभाव है, लेकिन प्रकृति को भी हमने इस प्रकार का प्रदर्शित कर दिया कि वर्तमान कालीन ऐसी विधाएं हैं कि हम विशिष्ट प्रकार के संकट की प्रक्रियाओं में भी ऐसा कार्य कर सकते हैं। यद्यपि आज बहुत से मेरे शिष्य मुंबई में आने वाले थे, आए भी होंगे, जुड़े हुए होंगे, और उनका सबका ये मानना था, सबको पता है इस बात का कि 2019 के बाद से वेबिनार बहुत जबरदस्त रूप से चल रही है, लेकिन मैं वेबिनार में व्याख्यान नहीं देता। लेकिन ये मैंने जैसे बताया ना, किशोर कुमार जी का जो द्वंद्व भाव है, जो ट्विंस स्वरूप है, वही ये है। मुख्य तो कार्यक्रम वही था, ये तो वैकल्पिक है, और वैकल्पिक कार्य करना ही पड़ता है। और मैं दूसरी बात इसमें और कहूंगा, पहले वैकल्पिक द्वंद्व भाव जो बता रहा हूं, यद्यपि बहुत से इन प्रक्रियाओं को, परंपराओं को चलाने के लिए इस वंश में सम उत्पन्न हुए हैं, और उनके सबके जैसे ही बीजे बीज भागे बीज भागा हुए, ये चरक का वाक्य मेरा नहीं है, तो वो कहते हैं बीज में, बीज भाग में, बीज भाग के अवयव में जीन्स इत्यादि जितनी भी प्रक्रियाएं आपके प्रत्येक वंश के जो श्रेष्ठतम पुरुष है उनमें से आप में आई हैं। इसलिए आप नेक्स्ट चौथा श्लोक आपके लिए प्रदर्शित है, प्रस्तुत है। आगे लें, नेक्स्ट। ये संभालयते, संभालना, संस्कृत में भी संभालयते कहने से संभालना हो जाता है। ये संभालयते हृदय सहृदय, अत्यंत ही सहृदय है, और ये सहृदयता इनमें यहाँ पैदा नहीं हुई है, पीछे जीन्स में से ही आ रही है। और ये संभालयते हृदय सहृदय स्तम धूत पापेश्वरम तत्पोत्रो रणजीत नाम वरो मुख्याधिकारी महान। CEO कहते हैं यहाँ पर, मैं तो मुख्याधिकारी इसका श्रेष्ठतम पर्याय है, और मुख्य तो सर्वदा मुख्य ही रहता है। देवा तादृश योग्य लोक जननो, भाग्य से ही ऐसा इस प्रकार के व्यक्तियों का जन्म इस संसार में होता है, जिन्होंने आप ये देखिए, उन्होंने जिस रूप में उसको वृक्ष को संस्थापित बीज रूप में किया था, आज वट वृक्ष का भी वह स्वरूप है। कई लोगों ने मैंने श्रीलंका में देखा एक वट वृक्ष, और उसमें सैकड़ों उसकी जड़ें अलग अलग जगह जमीन में गई हुई है, पृथ्वी में, भूमि में। तो ऐसा योग्य व्यक्ति जो है इस पौराणिक वंश में समुत्पन्न हुआ। कीर्ति यस्य से जीवती भुवने मान्य सदा सज्जने, इसलिए सज्जन लोग जितने भी हैं वो सभी ऐसे रणजीत पुराणे जी को मान सम्मान प्रदान करते हैं। ये तो हुआ जो इसका। अब दूसरा बात क्या है, दूसरी कि मुझे अध्यक्ष बनाया गया है, और अध्यक्ष का काम है, चरक महर्षि चरक कहते हैं, निर्विकार है परस्त्वात्मा सत्वभूत गुणेन्द्रिय। अध्यक्ष वही होगा जिसकी व्याख्या की है चक्रपाणि ने, यह निर्विकारत्वेन तिष्ठते। निर्विकार कैसे? यतिर यथा साक्षी सन जगत क्रियाम पश्यति। जिस प्रकार से यति योग के माध्यम से जो उस स्थिति तक पहुंच गया है, महाजी स्थिति तक पहुंच गया कि मुझे अध्यक्ष जैसे पद पर बैठा दिया रणजीत जी पौराणिक ने, तो उसमें ये होता है कि उसमें कोई विकार भाव उत्पन्न नहीं होता, अर्थात सबकी सुनता है, कहने का अधिकार उसको कुछ भी नहीं है। वो तो जो है जैसे वो न पक्ष की बोलता है अध्यक्ष, न विपक्ष की बोलता है, सबकी सुनेगा, न किसी से राग, न किसी से ईर्ष्या, न द्वेष। लेकिन अब थोड़ा सा हट करके मैं 2 मिनट किशोर कुमार जी के संबंध में भी इस बात को कहना आवश्यक है, क्योंकि सौभाग्य से मैं ऐसा अध्यक्ष हूं जो आयुर्वेद भी जानता हूं। उन्होंने बहुत श्रेष्ठता पूर्वक अपने विषय को प्रस्तुत किया है, और जिस विषय को उन्होंने प्रस्तुत किया है ये निश्चित रूप से उत्कृष्टतम है। यद्यपि इसमें जो इंटीग्रेशन वाली बात है, इसमें बहुत लंबी चौड़ी बहस हो सकती है, अनेक प्रकार के पक्ष और विपक्ष, वाद विवाद, तर्क कुतर्क वितर्क सब कुछ आ सकते हैं। लेकिन ये मैं सैद्धांतिक बात कहता हूं कि हम क्या किसको माने किसको नहीं माने अलग बात है, ये मैंने पहले ही कह दिया, तर्क की बात है। लेकिन जो दैव व्यपास्त्र है, युक्ति व्यपास्त्र है और सत्वावजय, ये तीनों भी यदि आपस में मिलते हैं तो इंटीग्रेटिव है। अश्विनी कुमारों को जिनको हम प्रारंभ में मानते हैं ट्विंस, वे दोनों भी, बनवारी गौड़ इस बात को मानता है कि वे दोनों भी इंटीग्रेटिव हैं। एक जो है शल्य का विशेषज्ञ था, ये इनके प्रमाण मेरे द्वारा कहने के लिए नहीं है, वेदों में देखिए आप। एक जो है शल्य के विशेषज्ञ थे। शल्य के विशेषज्ञ का तात्पर्य शल्य समुदाय में जो 8 अंग में आने वाले जितने भी विभाग है सब समाहित हो जाते हैं। और उन्हीं अश्विनी कुमारों में एक जो थे वो काय चिकित्सा के जितने भी समुदाय में आते हैं उनके वैशिष्ट थे। तो इसलिए ये इंटीग्रेटिव स्वरूप वहां भी था। इंटीग्रेटिव स्वरूप चरक में भी है। तत्र धान्वंतरीयाणाम अधिकार क्रिया विधौ वहां वो चिकित्सा करते करते कहते हैं भाई अब यहाँ तक तो हम ले आए, अब उसके बाद तत्र धान्वंतरीयाणाम अधिकार है, अब धान्वंतरी जो इसके आगे का काम करे। यही नहीं कहा उन्होंने उन्माद के प्रसंग में, जैसा कि इन्होंने भी बहुत कुछ कहा है, किशोर कुमार जी ने भी, कि हम मवन विराचन कराते हैं तो उनका बहुत बढ़िया जो है रिजल्ट मिलता है, और बाद में औषधि। ये चरक का सिद्धांत है। चरक कहते हैं इस बात को कि उन्मादे वातजे पूर्वम स्नेह पानम विशेषविद, जो विशेषज्ञ व्यक्ति है वो वातज उन्माद में पहले स्नेहपान करावे और फिर कुर्याद आवृत मार्गे तु सस्नेहम मृदुशोधनम, आवृत मार्ग है तो उसका मृदु संशोधन दे करके और उसको व्यवस्थित करना चाहिए। ये बात 13वें अध्याय में भी कह चुके हैं पीछे। स्नेहम अग्रे प्रयुंजित है तथा स्वेदम अनंतरम, पहले स्नेहन करो फिर स्वेदन करें, उसके बाद आपको वमन विरेचन करना है। स्नेहन करने वाला कराने वाला अलग विशेषज्ञ है, स्वेदन कराने वाला विशेषज्ञ अलग है, वमन का अलग है। भले ही से एक ही व्यक्ति में आ जाए पर सब ये विधाएं अलग अलग हैं, इसलिए इंटीग्रेशन वहां भी है। आप आगे देखिए कि उन्होंने फिर बताया कफ पित्तोद्भवे प्यादो वमनम से विरेचनम, कफ और पित्त भव उन्माद है उसमें भी आप विरेचन कराइए। इसका तात्पर्य है वातज उन्माद में भी विरेचन और संशोधन दोनों, स्नेहन करके संशोधन मृदु संशोधन कराएंगे, और कफ और पित्त वाले में भी आप विरेचन। विरेचन का तात्पर्य अकेला विरेचन नहीं है, यहाँ आप यदि आवश्यक समझें तो वमन, क्योंकि चक्रपाणी ने एक जगह व्याख्या की है कि वो कहते हैं कि विरेचन करवाने के ना दोषों का रेचन करवाने के कारण वमन को भी विरेचन कहीं कह सकते हैं और विरेचन को भी विरेचन कह सकते हैं। तो आपको यदि आवश्यकता हो तो आप वमन भी करवा सकते हैं, विरेचन भी करवा सकते हैं। तो यहाँ भी इंटीग्रेटिव स्वरूप है। आपने औषधियों की बात कही कि हम बहुत सी औषधियों का इस प्रकार के प्रयोग करें, तो देखिए एक सीधा सा स्वरूप है उन्माद का, सैद्धांतिक स्वरूप है। सैद्धांतिक स्वरूप क्या है कि पहले संशोधन करें उसके बाद औषधि दें। अब पहले संशोधन कर लिया उसके बाद औषधि देनी है, ये आपकी मर्जी है, कोई सी भी दे, आप आयुर्वेद की दें, एलोपैथी की दें, या और कोई दूसरे प्रकार की दें, तीसरी प्रकार की, चौथी, ये चिकित्सक पर निर्भर है। फिर भी यदि दोनों देनी है, जैसा कि उन्होंने एक बार कहा भी था, कई लोग पूछते हैं मैं ये दवाई लूं तो ये नुकसान तो नहीं करेगी, या इस दवा के साथ ये लूं नहीं, इसके लिए चरक कल्पस्थान में कहते हैं वहां एक सिद्धांत निर्धारित किया, विरुद्ध वीर्यम अप्येषाम प्रधानानाम अबाधकम। सामान्यतया तो हम औषधियों का, स्वयं पुराणिक जी जानते हैं और इनके अधिकारी सभी जानते हैं कि हम जब औषधि योग का निर्माण करते हैं तो द्रव्यों में अनेक प्रकार का हम रसगुण वीर्य विपाक इत्यादि का विचार करते हैं, ऐसे ही नहीं मिला लेते यदृच्छा से कहीं भी, जैसे चौपाटी पर सारे एक जगह आकर के इकट्ठे हो गए, ऐसा नहीं होता। तो कहने का तो वो यदृच्छा है, और यहाँ आज हम सब एकत्रित हुए हैं, ये व्यवस्था है। तो वहां इस प्रकार की व्यवस्था है कि कौन औषधि किस प्रकार से प्रयुक्त की जाती है। तो वहां रसगुण वीर्य विपाक से यदि विरुद्ध भी है और आप देना आवश्यक समझते हैं, तो जो प्रधान द्रव्य है उसका यदि विरुद्ध नहीं है, मैं ये इसलिए कह रहा हूं पुराणिक जी कि वर्तमान काल में लोग ये समझ रहे हैं कि बहुत ज्यादा अनुसंधान के कार्य हो रहे हैं। मैं कहता हूं जितना अनुसंधान का कार्य जो चरक सुश्रुत वाग्भट के समय में हुआ उसका शतांश भी हम नहीं कर रहे हैं, कर रहे हैं, बहुत अच्छी बात है। लेकिन कई लोग कहते हैं अपने व्याख्यान में, कई आयुर्वेद में अनुसंधान हुआ, बिना अनुसंधान के तो कोई कार्य नहीं हुआ। विमान स्थान के 8वें अध्याय में कहा है परीक्षक बहुविधम परीक्षा, अनेक प्रकार के परीक्षकों के द्वारा, अनेक परीक्षणों के द्वारा सब कुछ कर लेने के बाद है जो ये निर्णय कर रहे हैं। और जो सिद्धांत स्थापित करते हैं वो हमेशा वो प्रोटोकॉल है, हमेशा आपका परिणाम उसी प्रकार से आएगा, आप उसी विधि से करोगे तो ये एक सिद्धांत है। और परिणाम तो बदलते रहते हैं, वो क्या प्रक्रिया तो बदलती रहती है, सिद्धांत कभी नहीं बदलते। हम उस समय क्या काम में लेते थे, आज हम क्या काम में लेते हैं। इसलिए द्रव्यों का प्रयोग कहाँ की, यद्यपि इन्होंने एक जगह ये भी बताया, पोटेंशियल एरिया भी बताए हैं हमको, कहाँ कहाँ कौन कौन सी औषधियों के साथ विरुद्ध वीर्य स्वरूप होते हुए भी उनका प्रयोग किया जा सकता है, किया जाना चाहिए, ऐसा स्वरूप हमको लगता है। तो इसको निर्धारण करना है। वर्तमान में अनुसंधान के बहुत कार्य होते हैं, हो रहे हैं, ये बड़ी प्रसन्नता की बात है। लेकिन इतना अवश्य है कि प्राचीन जो शास्त्रज्ञ हैं या प्राचीन संस्कृत के जो शब्द हैं, पारिभाषिक जो स्वरूप हैं, उनमें हम देखेंगे तो हमको एक एक शब्द के अंदर अनुसंधान के अनेक क्ल्यू मिल जाएंगे, जिसको क्ल्यू बोल रहे हैं आजकल, अनेक सूत्र, अनेक ऐसे निर्देश, अनेक ऐसे वैशिष्ट हमको प्राप्त हो जाएंगे जिसको हम कर सकते हैं। लेकिन गूढ़ संस्कृतज्ञों को इसके साथ, अनुसंधान के साथ मिला, अनुपयोगी समझ करके टाल नहीं देना चाहिए, उनको मिलाना चाहिए। और ये बड़े मुश्किल से मिलते हैं, सौभाग्य से मिलते हैं, जो संस्कृत के पारिभाषिक शब्दों को कंठस्थ करके। और ये आपका कंप्यूटर का चिप फेल हो सकता है, लेकिन जो प्राचीन शास्त्रज्ञ हैं, जिनमें आपने नाना साहब की जितनी भी बातें बताई, वैशिष्ट बताए, तो ऐसे ही थोड़ी था, उनकी चिप थी इस प्रकार की कि किस प्रकार से जो कौन कौन सा कार्य करें, वो कभी फेल नहीं होती है। तो इस प्रकार के विशेषज्ञ विद्वानों का सहयोग लेकर के ये जो काम वर्तमान में सभी लोग कर रहे हैं, ये अत्यंत ही प्रशंसा के पात्र हैं। इनको बहुत बहुत धन्यवाद, बहुत बहुत एक प्रकार के आशीर्वाद। मैं इस श्रेणी में हूँ कि मैं मुश्किल से दीनानाथ जी उपाध्याय जैसे एक आध बुजुर्ग मेरे से सीनियर होंगे। 80 वर्ष में प्रवेश करने के बाद मैं समझता हूँ कि मैं अब आशीर्वाद दे सकता हूँ। आप सभी को बोलने के लिए बहुत कुछ है, लेकिन चूंकि अध्यक्ष की सीमाएं होती है, समय की सीमा होती है, आप सबको आशीर्वाद देते हुए, अपने आप को सौभाग्यशाली समझते हुए, इस श्रेष्ठ कार्य में मेरी संपृक्तता है, मेरा जुड़ाव है। और मैं तो ये भी कहता हूँ, अनेक स्थलों पर कहता भी हूँ, बहुत से लोग जानते भी हैं कि धूत पापेश्वर के जो श्रेष्ठतम कार्यकारी इस समय मुख्य यहाँ हैं, उनका मेरे से बहुत अधिक जुड़ाव है। ये केवल प्रशंसा के लिए नहीं कह रहा हूँ, ये वस्तु स्थिति है। और वस्तु स्थिति को जानने वाला व्यक्ति मन से जितना आनंदित होता है, उसको कभी उन्माद नहीं हो सकता, उसको ना किसी भी प्रकार के जो मानसिक विकार है वो नहीं हो सकते। मैं पुनः इस कार्यक्रम में उपस्थित सभी महानुभावों को आशीर्वाद, और जो मेरे नमन के योग्य हैं उनको नमन करता हूँ। ये मैं फिर कहता हूँ कि सभी लोगों को इस बात का कष्ट है कि हम एक साथ सामने मिलकर के इस प्रक्रिया को करते, लेकिन प्रकृति जो है वो हमारे वश में नहीं है। प्रकृति के वश में हम हैं और उसके वशीभूत होते हुए उसी प्रकार का कार्य कर रहे हैं। उतना ही श्रेष्ठ कार्य हुआ है, लेकिन ईश्वर फिर इस प्रकार का अवसर प्रदान करे कि सभी लोगों को साक्षात मिलकर के प्रत्यक्षतः जो परस्पर रेज किरणें जो एक स्थान से निकल के दूसरी तरफ जाती है, उनका भी आदान प्रदान हो। इसके लिए मैं तो पुराणिक जी फिर इस बात को दोहराऊंगा कि आपने जिस कार्य को किया, आज ये 1872 से चलता हुआ दूध पापेश्वर इस स्थान पर आया है। ये आपके 25 वर्ष स्थापित की हुई व्याख्यान माला भी जब 50वें वर्ष में तो आप आयोजित करेंगे, 50वें व्याख्यान में तो, और उसके बाद 100वां व्याख्यान जो करेंगे वो निश्चित रूप से श्री राम जी का, रंजीत पुराणिककार, बनवारी लाल गौड़ का नाम अवश्य लेंगे। चाहे 172 वर्ष बाद भी ये व्याख्यान माला चलती रहे तो ये ऐसा ही चलेगा। 151वां वर्ष हो गया मेरे ख्याल से, आप तो यह ज्यादा हो गई, 1872 के बाद 2025 है। तो मैं आपको आशीर्वाद और सभी को श्रेष्ठता पूर्वक अभिवृद्धि की प्राप्ति हो, इसका आकांक्षा करता हूँ, ईश्वर से प्रार्थना करता हूँ कि ऐसे अवसर हमको निरंतर देते रहें। धन्यवाद, आशीर्वाद। मेरी स्पीड बहुत तेज है बोलने की, मैं 20-15 मिनट का काम, जो 40 मिनट का व्याख्यान 15 मिनट में कर देता हूँ स्पीड। ये ईश्वरीय कृपा है, इसलिए मैंने जो कुछ कहना था सब कुछ कह दिया। आशीर्वाद।
धन्यवाद सर, हम हृदय से आपका धन्यवाद करते हैं जिन्होंने अपने मूल्यवान समय को हमें सम्मानित किया और इस ऑनलाइन व्याख्यान को सफल बनाया। धन्यवाद सर। As it said, a session never ends without sheer appreciation. I would request our respected Dean Dr. Ravidas More sir to kindly give a vote of thanks. Sir.
A very good afternoon to everyone. On behalf of Ayurved Prasarak Mandal, it is my privilege to deliver the vote of thanks for today's memorial lecture. First and foremost, I bow in reverence to the noble memory of late Vaidya Shrimant Nanasaheb Puranik, in whose honor this academic gathering has been held. His vision and contribution continue to inspire us. I extend my heartfelt gratitude to our distinguished speaker, Dr. Kishore Kumar Ramakrishna, for delivering such an enlightening and thought-provoking lecture. I sincerely thank our respected Professor Banwarilal Gaud Guruji for gracing this occasion and guiding us with inspiring thoughts. My special appreciation goes to the organizing committee and the technical team who worked tirelessly to make this online event seamless and successful. A warm thanks to all faculty members, students, my colleagues, and participants who joined us virtually from different places, from different institutes. Your presence and active involvement give meaning to today's program. I am thankful to Mumbai Vaidya Sabha, dignitaries of Mumbai Vaidya Sabha, Dr. Dinanath Upadhyay sir, Rajendra Sharma sir, President of Mumbai Vaidya Sabha, Sham Sundar Sharma sir, Secretary of Mumbai Vaidya Sabha. I am honored to thanks Ranjit Puranik sir, President of Ayurved Prasarak Mandal. Last but not least, I am thankful to all participants who have joined this online event. Thank you, one and all. Thank you.
Thank you. Thank you, Doctor. I think we can close the session.
Yes, yes. Thank you so
I
much.
hope we can count
I
on
am
you.
extremely honored by
Pleasure.
this.
Pleasure. And we'll send you the link of the entire, once we put it up on the website.
Yes.
I'll also share the
With
link
this,
as
we conclude today's
Thank-
online lecture session. I thank to our guest speaker, president, organizers, and participants for making this event a grand success. Thanks to all.
Thank you.
Thank you, sir. Thank you.
Thank you, sir. Thank you, sir.